So after these important words, it gives me a particular pleasure to welcome the EULAR Vice President, Marius Kouloumas, who's also from Cyprus, I think just by coincidence. And so he's a perfect speaker because he is an integral part of EULAR representing the patients. And this, I think, is a particular beauty of EULAR, that we have three pillars. We have the non-physician health professionals, we have the physicians and scientists, but also the patients are deeply integrated. And so the patients, of course, are the most important item, because that's why we're here for. And so we thank you very much for coming and giving your welcome remarks.
Thank you, Professor Burmester. Ladies and gentlemen, I would also like to warmly welcome you to today's conference. To mark yesterday's World Arthritis Day, we have gathered here to talk about a topic that is vitally important for people with rheumatic and musculoskeletal diseases. As a EULAR Vice President representing people with RMDs, I am therefore honored to talk on some key issues. The wider topic of integration of healthcare within Europe contains several areas that patients are strongly affected, but which demand continued attention by policymakers. Ultimately, everyone in EULAR, from patient organizations to researchers and health professionals, has set their sight on one key aim. We want to achieve the optimal care for patients with rheumatic and musculoskeletal diseases, that they can live full and independent lives, which will also contribute to reduce the enormous burden of these conditions in our societies. This is one of the guiding principles that EULAR and its patient organizations in particular work towards in all activities on a daily basis. At the local, national, and also European level, patient organizations offer support and advice to the people living with RMDs. We also work hard on the training and education of patients on how they can best deal with their condition. Moreover, we work closely with and provide our expertise to clinicians, health professionals, researchers, healthcare providers, and also with pharmaceutical and medical devices companies on how to better prevent RMDs and on how to improve medical treatment. But we also work closely with policymakers and other stakeholders on how to implement effective policy initiatives to reduce the enormous burden of RMDs. We all know that primary prevention is crucial, but we also know that secondary and tertiary prevention, as well as timely access to adequate medical treatments, are vital to improve the health and well-being of the more than 120 million people living with RMDs in the European Union, and thus reduce the severe disabling consequences of these conditions. As well all know, RMDs is the #1 cause of disability in Europe, and hence it is the main cause of work loss, absenteeism, and early retirement. However, what many people still do not know is that a significant part of the permanent disabling consequences of RMDs could be avoided if people had timely access to quality health care. Rheumatoid arthritis, for instance, can only be appropriately treated if diagnosed within 6 weeks of the onset of symptoms, and otherwise might lead to disability. However, access barriers to health care are still very important in EU member states, and have been even more important in the last year due to the pressure of the financial crisis on healthcare systems. As we have seen in the conference EULAR organized last year in Brussels, and that was kindly hosted by Mr. Hadjigeorgiou in the European Parliament, people with RMDs often have to cope with a number of barriers, such as long waiting lists, the lack of well-trained general practitioners and other care professionals, the lack of sufficient specialist and specialized care centers, the absence of scientific-based standards of care, the lack of specific treatments in the region or countries they live in, etc. The possibility of getting treatment in another EU country and being reimbursed for that do not solve the core problems of access to care that we face in many member states. But it certainly has the potential to open new opportunities for patients. For us, European patients, it is essential to receive the best possible care as early as possible, regardless of the country we live in. And for our societies, for our health and social security system, it is essential that people with severe disabling conditions, such as RMDs, receive adequate treatment, either at home or in another EU member state, so that we want to reduce the enormous burden of these conditions. We therefore celebrate the development of the EU single market in the health sector, and particularly the adoption of the directive on patient rights to cross-border care. We are aware of the many difficulties and challenges the implementation of this initiative have, and do hope this conference will contribute to identify possible solutions to address those challenges. Personally, I have also benefited from the new mechanism, which has allowed me to seek treatment in Germany and still be reimbursed for this in my home country of Cyprus. I therefore have a first-hand experience and have faced some of the issues that probably many other people still face. The reason I sought treatment abroad was because this time was not available in my home country. Some of the challenges I faced were that the application process was time-consuming until I was approved to go, as well as the problem of bureaucracy. Another challenge was traveling to a foreign country with a different mentality and different healthcare system without having your relatives by your side to support. And finally, another potential challenge is the language barrier that could exist. In the end, though, from this journey I received a high standard of treatment as well as a good level of rehabilitation. To summarize then, there are a great number of reasons why seeking treatment in another country is important for us as patients. It helps us to access high-quality care by the best specialists in Europe, and crucially also receive health care in timely manner. Fundamentally, it offers us much greater choice to receive this optimal care. However, as you are surely aware, one of the reasons why we are discussing the topic today is that patients still encounter substantial barriers when seeking health care outside their home country. These obstacles and barriers have to be removed. During the Belgium EU Presidency Conference on Rheumatic and Musculoskeletal Diseases in 2010, it was adopted the EULAR Brussels Declaration. One of the calls to policymakers at the EU and national level was that people with rheumatic and musculoskeletal diseases should receive prompt access to high-quality care, ideally in specialized centers, thus maximize long-term quality of life. People with RMDs, clinicians, and health professionals in EULAR, we are all committed to contribute to make this a reality. And we do hope policymakers and stakeholders will join our efforts. After all, we must not forget that magnitude of the burden of RMDs. Delivering on a truly integrated provision of health care for patients in Europe can make a great strides in easing the burden of RMDs on each individuals as well as health and social care system. We do hope the conference today and follow-up activities in the future will contribute to this end. On behalf of the people with RMDs, I would like to thank you once more to be here and wish you all a very successful and productive day. Thank you for your attention.